our top reason or top indication for getting sleep testing is to investigate the question of, do we have or are we dealing with some version of sleep disordered breathing? When we're looking at doing home sleep testing, it's only supposed to be indicated for obstructive sleep apnea or the investigation of such. So if you're looking at something like narcolepsy or the parasomnia, something where you're going to need brainwave data or limb movement data, a home test is not going to be appropriate. And so you're going to want to keep that in mind as you go through the process. Now, just because we have a diagnosis doesn't mean that we're totally done with our need for testing. So we have the question of, do we have this problem, right? And then how do we fix this problem? So if we're going to do CPAP therapy or one of the more advanced modes of respiratory support, then we may need to do some testing to see what do we need to get the job done. Right? And then there are other scenarios where we need to retest to make sure that the thing we're doing is actually working. Now, when we're talking about CPAP or BiPAP, sometimes we can just go off of the clinical effect of that therapy. Do you feel better? Do your numbers look better? Are the goals that we set forth, are those things doing better, or are we kind of maybe missing something? And when you think you're missing something, it's probably a good time to consider maybe we should make sure that the treatment we're doing is actually working. Because there's no rule that says you can have only one sleep disorder or only one health disorder, right?